Hello everyone, Tutor RN here with just hopefully a quick video on how to think like a nurse. If you've watched my Cornell Note video, I mentioned that you need to think like a nurse, which is critically thinking, and it's probably one of the harder aspects of nursing to do, to get into that mindset, to engage your brain and expand your knowledge. And I do plan on having a more in-depth video on that later, but this is, like I said, just a quick step to thinking like a nurse. So let's try to make this one a quick video this time. So we're going to start off with a little exercise. What I want you to do is to get a sheet of paper, and I want you to write down everything that comes to your mind when you see the following word. I'm only going to give you 30 seconds. So if you need to pause this real quick to grab your sheet of paper and pen, go do that because your 30 seconds is starting right now. And go. Okay, stop. 30 seconds is up. We're not going too in depth in this. We're not going to cover everything with fluid volume excess. In fact, I'm just doing three things that came to my mind. Way more came to my mind, but we're going to keep it simple for video's sake. So when I saw fluid volume excess, what came to my mind was increased weight, increased blood pressure, and edema. Those are my three basic things that came to my mind. Now, we're going to take those three things and take it a step further. So when I see increased weight, I immediately think I need to do daily weights and I need to do INOs. When I saw increased blood pressure, I immediately thought we might be given increased blood pressure with fluid volume excess and edema. I immediately thought we're going to give them some diuretics. With edema, I also thought we need to elevate that extremity and we need to provide skincare. So I started with fluid volume excess. I expanded my brain to think of everything I could think of with fluid volume excess. And then with each of those things, I expanded it again to everything I could think of with those. Now, again, this is not all encompassing. This is just a short, quick demonstration. So we've expanded. Let's expand it again. So with daily weight, I immediately thought I need to do it at the same time. I need to have the same clothes. I need to be in the same bed. That's what comes to mind with daily weight. When it came to INO, I immediately started thinking I needed to include oral fluids, liquid medications, their IV fluids for intake, their urine output, their vomit output, their diarrhea output. For blood, both intake and output, that's immediately what came to my brain when I saw the prompt INO. When it came to diuretics, my brain immediately went, that's going to decrease their blood pressure, which again made me think orthostatic hypotension and that they needed to be on fall risk. So one word or three words, fluid volume excess, and I immediately started to make myself expand beyond that little bit of information to think of everything I possibly could and try to connect my lines. Now, why is this important? Because this is what is called a concept map. I don't typically do this in my notes in written concept map form, but it's what I try to get my brain to do. And this is what you need to try to train your brain to do. You have your concept, which is fluid volume excess, and we're going to learn everything we can about it, and we're going to try to link those things to other concepts we've learned and link those concepts to other concepts, and we try to make this big, massive spider web of concepts that are linked together. And this is the basis of nursing. This is how you are tested, and in actual practice, this is what you have to do. So you're given a report on a patient, and they're listing all these things, and your brain needs to be starting to grab and link and gather all these different concepts together of what you might see, what you might do, what you might expect. So I want to kind of show you how I do it in action. And again, this is very simple, very condensed. It is not all encompassing. So say we're doing cardiovascular, we're studying cardiovascular system and we're talking about CHF. And in those notes, it says, signs and symptoms of CHF exacerbation could be shortness of breath, dyspnea, pulmonary edema, crackles, increased blood pressure, and there is our word, fluid volume excess. Now, in my notes, I would immediately make those signs and symptoms into a list, and then with each sign and symptom, I would include the why. Why am I seeing shortness of breath? Why am I seeing dyspnea? Why am I seeing pulmonary edema? Why am I seeing crackles? Why am I seeing an increased BP? Why am I seeing fluid volume excess? Now, I know there are more signs and symptoms of CHF, but again, this is small. Knowing that why, because I could have increased blood pressure in a number of diseases. But why am I seeing it in this disease? What makes it unique to this disease? What is the patho going on behind that one? And then on top of that, I also kind of try to jot down a little side note of everything that comes to my mind when I see it, which is what we kind of did in our concept map. So when I saw fluid volume excess, I was already thinking diuretics and weight gain and eyes and nose and edema, and I was already putting those things in there to keep my brain active and thinking of all the things that could come with fluid volume excess. And I do that so that when I'm studying, I don't get kind of that tunnel vision to where I'm just reading these words and not expanding it beyond the words that are on the page. Because let's face it, your notes are just going to list these signs and symptoms. Sometimes they might go into more detail, sometimes they don't. Things that are involved with fluid volume excess, if you already are on cardiovascular, then you've already had a lecture previously on fluid and electrolyte imbalances. They expect you to bring that information over to cardiovascular. They're not going to go into big, long detail, everything you would see with fluid volume excess or everything you need to do with fluid volume excess. So you need to try to bring past learning experiences into your current set of notes. So we get to a test, and here's a sample test question. A client is in exacerbation of CHF. Which of the following interventions is appropriate for the nurse to perform? Select all that apply. I know we all love select all that apply questions. So we have A, daily weight, B, insert a Foley catheter, C, advise the client to change position slowly, D, maintain legs in a dependent position, and E, document intake of 20 milliliters water with PO medication. So this is my question. Now, we were just reading the words off of the notes. If we just had those notes and all we knew were those signs and symptoms, if we didn't expand further, we would get to this test question and go, oh my gosh, I don't know. I might have a little difficulty with this because while I was studying for just this test, I only studied the words that were on the page. I didn't try to expand it further than the notes on the page. So the answers to this question, I honed in on exacerbation of CHF. So my brain immediately went to my notes and all those signs and symptoms. And then I was like, okay, I'm looking at my questions here, looking at my answer choices, and I'm like, oh, daily weights. Well, CHF, they would have fluid volume excess, and I know that if they have fluid volume excess, I need to do a daily weight on them. Insert a Foley catheter, my brain didn't expand to that. I mean, obviously we do not insert a Foley catheter unless they are just unable to void because the risk of infection is way too high. But again, even just seeing that question or that answer B choice, I expanded my brain to what I knew about Foley. It wasn't on my notes about CHF, but just expanding beyond it, Is there anything in this stem that makes me think that they are unable to void? And that is one of the only reasons we would insert a Foley catheter. With C, advise the client to change position slowly. Absolutely. When I was doing my notes and I thought of FEE, at that point I thought we're going to give them diuretics to try to get some of that fluid off. That's going to decrease their blood pressure. And I'm also bringing in my knowledge from pharm that anytime we decrease blood pressure, they are at risk for orthostatic hypotension, which again puts them at a fall risk and makes me want to teach them to change position slowly, to dangle, to stand up with assistance. So I would choose C. Maintaining legs in the dependent position. Dependent is the opposite of elevation. Again, when I thought of fluid volume excess, I thought of edema. And when I think of edema, I think elevation. So I know that D is not right. And then the documentation of 20 milliliters of water with the PO meds. Again, I saw fluid volume excess. I went to I's and O's, and I know that I need to include all intake of oral fluid. So because I expanded my thinking on the notes about fluid volume excess, I was able to think about all the things I might see, I might do, I might expect the doctor to order, and this allowed me to answer the question. Again, if I had just read the words on the page and did not force myself to expand beyond those three little letters of FDE, I might have had trouble answering this question. So it's just really important when you're taking notes, when you're listening in class, when you're reading your chapter, and it just throws a word, oh, client is at risk for orthostatic hypotension, you, in your notes, or just force your brain to think about it. What would I do for this patient? Because a lot of the times the question and your answer choices, like your question is step A and your answer choices are step Z. And you have, 24 other steps in between there. And if you didn't expand your brain to think further and go to the far distances of everything you could possibly do for this client or see or expect, you might not be able to answer some of those questions. So I really encourage you when you're doing your notes, reading your book, and it just throws this list of signs and symptoms or this list of interventions, really expand beyond that. If you think about you're studying where they would have had, some type of surgery, and all it says is, monitor patient for hemorrhage. That's great. You need to monitor your patient for hemorrhage, and that's what's going to be in your notes. But if you don't force yourself to think, what would I look for hemorrhage? What would I see? And actually put that in with those notes. When you're studying, you're not thinking about that. You might not be thinking about all those signs and symptoms that you might see to let you know they're hemorrhaging. Or if it's just a general, you have a patient that's post-op, if I'm not automatically thinking I need to look for hemorrhage, I need to look for infection, I need to turn, cough, deep, breathe. If in my notes it just says, post-op nurse management, and I didn't force myself to write everything that came to my mind when I saw post-op nurse management, I'm just studying a word. I'm not studying a concept. So force yourself to make concepts. Don't just read the words on the page. Force yourself to expand your thinking on those. And that's your critical thinking. That is what will help you get through your NCLEX style questions. I hope this helped. Please leave a comment below if you have any questions. As always, like the video, subscribe to my channel, and we will talk to you next time. Bye, guys.